Welcome, everyone. Today, we'll be discussing substance-related and addictive disorders. If you are new here, please subscribe, like, and share. Our objectives today are comprehensive. We'll define key terms, explore predisposing factors, and learn how to assess patients. We'll also cover diagnosis, nursing interventions, patient education, outcome criteria, and the issue within our own profession. Finally, we'll discuss codependency and treatment modalities. Substance use disorder encompasses two main categories: substance use disorders and substance-induced disorders. Addiction falls under the first, representing a compulsive reliance. Remember, addiction can stem from prolonged medication use for pain, highlighting the importance of careful monitoring. Addiction manifests in various ways. It can interfere with work or family obligations, lead to failed attempts to quit, and cause intense cravings. Patients may experience relationship difficulties and engage in risky behaviors while impaired. Tolerance and withdrawal symptoms are also key indicators. Substance-induced disorders include intoxication and withdrawal. Intoxication involves disturbances in cognition, perception, and behavior due to psychoactive drugs. Withdrawal occurs upon reducing or stopping prolonged substance use, resulting in physical and psychological changes. Psychoactive substances are diverse. They include alcohol, caffeine, cannabis, hallucinogens, inhalants, opioids, sedatives, stimulants, and tobacco. Each class has unique effects and risks, requiring specific nursing considerations. Several factors contribute to substance abuse. Biological factors like genetics play a significant role. Psychological factors, such as developmental influences and personality traits, also contribute. Sociocultural factors, including social learning and cultural norms, further influence substance use. Alcohol use disorder has distinct phases. The pre-alcoholic phase involves using alcohol to relieve stress. The early alcoholic phase includes secretive drinking. The crucial phase involves loss of control. The chronic phase is characterized by physical and psychological dependence. Alcohol affects the body in many ways. Peripheral neuropathy causes pain and tingling in the extremities. Alcoholic myopathy, affecting muscle tissue, can be acute or chronic, often linked to B vitamin deficiencies. Wernicke-Korsakoff syndrome is a serious consequence of chronic alcohol abuse. Wernicke's encephalopathy presents with confusion and ataxia, requiring immediate thiamine administration. Korsakoff's psychosis involves memory loss and confabulation, necessitating nutrition and abstinence. Alcoholic cardiomyopathy involves lipid accumulation in heart cells. Esophagitis causes inflammation and pain in the esophagus. Gastritis inflames the stomach lining. Cross-tolerance with other medications means higher doses may be needed for desired effects. Alcohol can cause both acute and chronic pancreatitis. Alcoholic hepatitis, resulting from long-term heavy drinking, presents with various symptoms. Sexual dysfunction can occur both short-term and long-term. Cirrhosis is the end stage of alcoholic liver disease. Chronic alcohol use destroys liver cells, replaced by fibrous tissue. Complications include portal hypertension, ascites, esophageal varices, and hepatic encephalopathy. Alcohol use during pregnancy can lead to fetal alcohol spectrum disorders, FASDs. These disorders can cause abnormal facial features, growth problems, and neurodevelopmental issues. Early identification and intervention are crucial. Alcohol intoxication occurs at specific blood alcohol levels. Death can occur at very high levels. Alcohol withdrawal begins within hours of cessation. highlighting the need for careful monitoring and management. Intoxication symptoms vary. They include drowsiness, slurred speech, tremors, and impaired thinking. Nausea, vomiting, and changes in vital signs are also common. Behavioral changes like belligerence and disinhibition can occur. Slide 17 is a question. How do we assess a patient for alcoholism? Assessment involves asking questions and using screening tools. The CAGE questionnaire is a simple, effective tool. The CIWA scale assesses withdrawal severity. Blood alcohol content provides objective data. Remember to approach patients with empathy and without judgment. Nursing diagnoses are crucial in addressing substance use disorders. Denial, ineffective coping, and imbalanced nutrition are common. Risk for infection, low self-esteem, and deficient knowledge also require attention. Withdrawal symptoms and suicidal ideation must be carefully monitored. Positive outcomes include abstinence, accepting responsibility, and demonstrating adaptive coping. Patients should acknowledge the link between their problems and substance use. Improved self-worth and understanding the importance of sobriety are also key. Nursing interventions for alcohol intoxication include frequent vital sign monitoring and suicide precautions. Protect the airway and assess for injuries. Evaluate the need for IV glucose and seizure precautions. Counsel the patient about alcohol use. Nursing interventions for alcoholism involve counseling, establishing control, and medication. Explore the causes of alcoholism and encourage admittance. Identify triggers and encourage AA attendance. Disulfiram can help maintain sobriety, but requires careful monitoring. Withdrawal is the physiological and mental readjustment following substance discontinuation. It occurs after prolonged use and includes physical and psychological symptoms. Recognizing these symptoms is crucial for effective management. Alcohol withdrawal symptoms include tremors, insomnia, and anxiety. Delirium tremens is a severe form with disorientation and hallucinations. Nursing interventions include benzodiazepines, vital sign monitoring, seizure precautions, and a quiet environment. Alcoholism affects the entire family. Family members must focus on their own well-being. Help them understand the stressors faced by the person with alcoholism. The support system cannot help unless they are stable. Al-Anon provides valuable support. Opioids include morphine, heroin, and codeine. They have sedative and analgesic effects. While they have legitimate medical uses, they can lead to addiction. Overdose deaths are a significant concern. Opioids affect the CNS, causing euphoria and mood changes. They also cause constipation and hypotension. Sexual function and libido can be decreased. Understanding these effects is crucial for patient care. Opioid intoxication involves euphoria followed by apathy. Impaired judgment and pupillary constriction are common. Severe intoxication can lead to respiratory depression, coma, and death. Opioid withdrawal symptoms include dysphoria, muscle aches, and nausea. Lacrimation, rhinorrhea, and pupillary dilation are also common. Abdominal cramping, diarrhea, and insomnia can occur. Nursing interventions for opioid overdose include maintaining the airway and controlling seizures. Check LOC and vital signs. Administer naloxone to reverse respiratory depression. Methadone and buprenorphine can be used for maintenance therapy. Sedatives, hypnotics, and anxiolytics include barbiturates and benzodiazepines. They provide anxiety relief and anesthetic effects. They can produce physiological and psychological addiction. Cross-tolerance and cross-dependence are important considerations. Sedatives and hypnotics affect the CNS, causing respiratory depression and hypotension. increasing dosage can lead to coma and death. Understanding this progression is vital for safe medication administration. Sedative, hypnotic, or anxiolytic intoxication can range from disinhibition to coma. Withdrawal symptoms include anxiety, insomnia, and tremors. Severe withdrawal can be life-threatening. Nursing interventions for sedative overdose include maintaining the airway and checking LOC. Start an IV and administer sodium bicarbonate. Activated charcoal and gastric lavage may be necessary. Hemodialysis and phenobarbital can also be used. Cannabis includes marijuana and hashish. Synthetic cannabinoids and CBD are also available. Understanding the different preparations is important. Cannabis affects the cardiovascular system, causing tachycardia. Respiratory effects include laryngitis and bronchitis. Reproductive effects include decreased sperm count. CNS effects include euphoria and relaxation. Cannabis intoxication involves impaired motor coordination and euphoria. Anxiety, fatigue, and paranoia can occur. Physical symptoms include conjunctival injection and increased appetite. Stimulants include amphetamines, cocaine, and synthetic stimulants. Understanding the different types and their street names is important for assessment. Stimulants affect the body, causing tachycardia and hypertension. Anxiety, irritability, and insomnia are common. Euphoria, hyperactivity, and hallucinations can also occur. Stimulant intoxication involves euphoria and changes in sociability. Hypervigilance and anxiety can occur. Caffeine intoxication can result from consuming excessive amounts. Stimulant withdrawal symptoms include fatigue, irritability, and depression. Headaches and nightmares can occur. Caffeine and nicotine withdrawal are also common. Nursing interventions for stimulant overdose include maintaining the airway and starting an IV. Use cardiac monitoring and check LOC. Activated charcoal and gastric lavage may be necessary. Monitor for suicidal ideation. Hallucinogens include LSD and PCP. They are often referred to as mind-expanding drugs. Hallucinations are usually visual. Flashbacks can occur months after use. Hallucinogens affect the body, causing nausea and pupil dilation. Psychological effects include distorted vision and paranoia. Heightened responses to stimuli and altered perceptions are common. Hallucinogen intoxication involves nystagmus and confusion. Hyperactivity and hallucinations can occur. Distorted body image and delirium are also common. Nursing interventions for hallucinogen overdose include maintaining the airway and controlling seizures. Check LOC and reduce sensory stimuli. Small doses of diazepam may be used. Protect from self-injury. Treatment modalities include psychopharmacology and counseling. Group therapy and self-help groups are also effective. Family and support persons should also consider treatment. Self-help groups provide valuable support. Adult Children of Alcoholics, Al-Anon, and Narcotics Anonymous are examples. Each group has specific membership criteria. This table summarizes different drug classes, their symptoms of use and therapeutic uses. It also lists symptoms of overdose and nursing considerations. This table summarizes the intoxication, withdrawal, and comments for different classes of drugs. It provides a quick reference for understanding the effects of various substances. Codependency affects those involved with addicted individuals. They often disown their own needs to respond to external demands. Low self-esteem and weak boundaries are common characteristics. Substance abuse among nurses is a serious concern. A significant percentage of nurses screen positive for substance problems. Mandatory reporting laws are in place. Be aware of cues that may indicate a problem. If you suspect a colleague is impaired, Keep an objective record and report to your supervisor. The state board may get involved. Peer assistance programs can provide support and treatment.